We've been able to ramp this up in a relatively short amount of time, but we want to keep doing it.
The governor announcing expanded COVID-19 testing during his briefing today. He says about 1 in every 140 Floridians have been tested for the virus. The governor also saying expanding testing criteria is now in place to include more Floridians. That has to do with the drive-through sites, those mega sites that have been set up in multiple locations across the state.
All right, and joining us now over the phone again today to help answer some more of our questions is Dr. Christie Alexander with the FSU College of Medicine. Dr. Alexander, thanks so much for being here. How are you doing at the end of this week?
Doing okay. It's been a very, very busy week, as you can imagine, but hanging in there. Thank you for asking.
All right, that's good to hear. We're going to jump right in because we have a lot of questions to get to. The first of which is yesterday we learned more about the CHIME model. It says COVID-19 could peak here in June. It also suggests our area could see a significant shortage in hospital beds to treat patients. Could you explain a little bit more about the model and your reaction when you heard about the projections?
Sure. So the CHIME model was created by researchers out of the University of Pennsylvania to look at peak projections in our areas locally. The models that we've used previously look at the entire state. So the ones that we talked about a couple of days ago project the peak in Florida to be April 26th. But when you look at a model like CHIME, it's taking into effect our regional population, the infection rates that we know about right now in our area, and how well we've been doing with social distancing. So when you put all of that information together, it predicts for Tallahassee and the Leon County area that our peak will be much later. And that's probably due to the fact that, for one thing, our mayor was good about putting stay-home orders in place very early. He was looking at flattening that curve. We knew it was going to hit us at some point. It was just a matter of when. And again, if you remember how to flatten the curve, if the peak happens later, it gives our communities a longer time to prepare and to get ready. Now, understandably, our local model is saying that we're going to run out of beds and not have enough space, which is a little frightening. That is a little scary, given the current numbers. When you see 82 cases, and it doesn't seem like those huge numbers like we see in Orlando or New York or even Miami, for that matter, it seems kind of surprising. But the good news is we have time to prepare for it and to find ways to handle that before it happens.
Okay, so there are some good aspects, I guess, to that projection, but obviously it caused a lot of worry in the community when they came out yesterday, or when that model came out. Is there anything more that the public can do right now to combat the odds?
Yes, so great question. Again, we always go back to physical/social distancing, whichever term you want to use, but staying home as much as you can. And if you have to go out, making sure you are using a face cover at this point. So as we said the other day, CDC came out with new guidelines saying we should all be wearing masks if we have to be out in public. And even then, with the mask on, maintaining that 6 feet of distance. That we know works. So as much as we can do that as possible, the better.
All right, we're going to get to a little bit more on that in just a bit. First, I want to ask, a lot of the focus placed on the growing number of cases and deaths across the state and country, understandably so. But what can we take from the current recovery rate?
So the recovery rate, it's a tough one because we're looking at, okay, so if we only know about the virus in regards to who was tested, then it's looking like the recovery rate is about 80%, which means that for every 4 people that recover, 1 person dies. And that sounds terrifying. But that doesn't take into the effect the number of asymptomatic people out there that weren't tested, or the number of people with mild cases that are not tested either. So while we're increasing our test rate, I think that will help reduce or increase the recovery rate numbers, if you will. Now, what we do know is for mild cases, the recovery time is 2 weeks, and for more severe cases, it's 3 to 6 weeks. So for that part of it, we at least know the time frame that we're dealing with. But in terms of recovery, it's sort of a skewed number at this point because we just don't know how many cases are out there.
And let's talk now about terminology. Many are using the term social distancing and quarantine interchangeably. Can you define the difference between those two?
Absolutely, and it's true. I've even seen it amongst friends where it's like, oh, well, it's the same thing, right? As long as I just stay away from people even though I've told to be, just not go around people. Quarantining truly means don't leave your house. If you are suspected to have symptoms or you've been diagnosed with coronavirus, make sure you are actually staying in your house for the number of days that you've been told to do so. That keeps everyone else from getting the virus. So the difference between that and social distancing is that social distancing still allows us to go to the store if we need to, for example. While the stay-home orders are to stay at home, with social distancing, it's allowing us to go out and do the essential needs that we need to do, like, for example, go to the grocery store. So that's the main difference. Quarantining is truly you cannot leave your house. And within your home, if you live with others, it can even mean quarantining yourself to a certain area of your home so as not to get other people in your home infected.
We've been reporting on several assisted living facilities and residential homes that have seen a lot of cases in our area. Is it possible to stop the spread once it reaches places like these? And also, why does it spread so fast there?
That's a great question. The reason why it spreads so fast is just that it's such close quarters. It's hard to keep people 6 feet away from each other. And I think what happens is those people that were pre-symptomatic at the beginning, like they came in and didn't even know they had the virus, and so they didn't know they needed to stay 6 feet away, that sort of thing. And then all of this, everybody living in such close quarters, it's easy to spread. So yes, the answer to the first part of that question is you can slow the rate within close quarters like that by, when you know that there are cases, keeping everybody very much in their own quarters, spreading people out as much as you can, and people coming in, everybody wears a mask, and people coming in and out of the facility, making sure there's a lot of hand washing and sterilization of the entire facility.
And Dr. Alexander, if you could give us a quick update on research. What are you watching as far as treatment and any talk of a possible vaccine?
So the main source that I'm always referring to, of course, is the CDC. I'm always going to that. I was also on a webinar yesterday with the American Medical Association watching what they're looking at. And if you've thought about it, if you thought that, okay, this treatment might work or that treatment might work, then it's being researched. The thing is, we still don't have any proven effective treatments, scientifically proven treatments to date. So we're still very much watching that. The talk of a possible vaccine, they said at the very onset of this, it could be 12 to 18 months. And I've heard some projections of it being around December, which would be the 12-month point from when we first started seeing these cases. So yes, everything is in the work. Everything is being studied, and we're hopeful that we'll have something that we can start using very, very soon.
And we touched on this. You mentioned it, the CDC recommending folks wear face masks now. What are some ways to effectively disinfect and reuse those masks?
So this is actually really great information because if you have a mask, whether it's cloth or whether it's a surgical mask, they can be decontaminated and reused. The big thing is that you just need a large pot, 8 to 12 quarts, filled about halfway full to a rigorous boil. You put a strainer over that, put your masks inside, cover the pot, and wait 15 to 30 minutes to steam everything away. The big thing is the temperature of the water. The temperature needs to be at least 60 degrees Celsius, 140 degrees Fahrenheit, so you'll need a thermometer to see that it's at that level before you begin the steaming process. We've actually been doing this with the masks in our office and reusing them accordingly. The other big part of that is to make sure the mask is completely dry before you use it again. So again, it's that big pot, halfway full, steam to 60 degrees Celsius, 140 degrees Fahrenheit for 15 to 30 minutes, covered. So that will decontaminate your mask.
Yeah, that description of a rigorous boil definitely brought the image to my head. Was a great way to kind of describe it for folks. We've had people reach out to us about concerns about the lack of response from hospitals, about the status of their loved ones in their care. What should family members reasonably expect about communication from hospitals during this time?
So I reached out to a couple of folks, and luckily in our area, I've at least from the folks I've been speaking with at Tallahassee Memorial, they haven't heard of any communication delays, but I can give you some pointers as to what to do. The main thing is to call the main line and ask for the patient's room, and if you need to speak with a nurse, they'll connect you to a nurse on that floor. Another great idea is to make sure that the nurses that are caring for your loved ones know who the main point person is to contact. If they have a list of many, many people to call, it's going to take even longer to get back with you. But if there is one main point person and a good phone number for that point person, they'll get in touch with you sooner. And lastly, another great rule of thumb is to be clear on what it is that you're asking. So if there's something specific that you need to know about your loved one, that way the nursing staff can ask the physicians and the people coming through that specific question so that they can get the information back to you even quicker.
Dr. Alexander, a lot of people obviously, were taken back when you said a couple weeks ago that you had been using your mask for several weeks. Has that situation improved for you and for doctors in our area as far as you're aware of?
We are looking at finding personal protective equipment from all sources. We're getting things donated, which is just absolutely so wonderful. And I just thank everybody out there for all of their donations. We are still being very, 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 very conservative with our equipment, though, because we do think it will, if it's not running out already, it's going to, given these projections, which is why we're still reusing our masks. And as I just said, we would never use this decontamination procedure in the past if we had enough of it. So we still are low on supply, but at least now we have measures to feel safer in what we're using.
Dr. Alexander, before we let you go, is there anything else that you'd like to add today?
Just encouragement. I know it's really, really hard to hear that we're not going to reach a peak until maybe late May, early June, mid-June. That's a really scary prediction for a lot of people. The one thing I can say is just to think of it as our way to all protect each other. We don't want to get this thing. None of us do. So all of us can protect each other by just continuing the stay-at-home orders and seeing it as our way to protect the world, if you will. I mean, that sounds like grandiose, but truly, it's our way of doing what we can do to keep this thing from spreading. So even with Easter coming up, that has to be hard, all the things that we would normally do. But just know that you're doing the right thing when you're staying home.
With everything that you have going on, we sure do appreciate you taking the time to answer our questions and to speak with us time and time again.
I'm so thrilled to be able to do so. Thank you.
All right, Dr. Alexander, thanks so much.
All right. So much good information there. And I know a lot of people probably were running to get a pen and a piece of paper to jot some of it down. We have you covered. We're going to go ahead and post this interview, as we do with all the interviews that we conduct with Dr. Alexander, on our website, WCTV.tv.